When you speak to your patient, how do you frame it?
Great question, because it's not, you can't just say you have HPV. It has to be a discussion. And so what I would tell a patient, I always say, it's very common. And anyone who's ever had sex is at risk, and it's not a sign of any off behavior in any way, shape, or form. I would say probably a majority of young people have had HPV or have been exposed to HPV. And so if the other thing that's really important to say to people, of course, I explain what HPV is, but then I also say it's not a reflection of when you got it. Having an HPV test doesn't mean you were exposed in the past 2 weeks, so it could have happened at any point in your life. I've had people get in fights over this, and certainly that's not appropriate. I then sort of, people can sort of kind of go a couple different ways with this. Sometimes they get very worried about passing it on to their partner, and basically, I would tell such a person that it's already been passed back and forth, so it's not something that you can really do. The best thing that you can do if you have HPV, if you're a smoker, stop smoking, and anything that you can do to increase your immune system can help. So making sure to eat right, exercise, sleep. Additionally, there's some, eat a lot of broccoli. Those are things that I tell people to do when they have HPV. Another important thing is that having HPV doesn't mean you're going to have cancer. A lot of the times the immune system kicks in and can clear it. And sometimes it does not, but it just means you need to be followed a bit closer.
Great. Thank you, Dr. Blank.